This presentation is going to be on how to cement a single unit crown. When you first get the crown back from the lab, try it on the model and see how it fits. Here we're looking at the buccal, the lingual, occlusal, looking at the die that's trimmed, and we're also looking at the solid model on the bottom. I just want to check to make sure that everything looks like it's fitting the way it should, that the lab did a good job. When the patient does arrive, we at our office at least get the patient numb, because we find even if the tooth has been root canaled, the gum tissue that we're going to be working around can be kind of tender. So in our office, we just prefer to get all patients numb when we're doing a crown seat. So in this photograph, you can see the patient presents wearing their temporary and doesn't really appear to be too much in the way of gingival inflammation. So this should be pretty straightforward. Go ahead and remove the temporary. And as you can see in that top picture, there will always be some cement left over on the tooth, or of course inside the temporary itself. But once you get it cleaned up, that's what the tooth should look like in the bottom corner. As a side note, look where the cement is on the mesial and the lingual of that top photo. It looks like some of that cement is actually crammed down below the gum line, or it's placed subgingivally. After that's been removed, you can see it's those areas on the tooth that are the most inflamed. So in cleaning out your temporary cement, it's a good idea to try to get out all the cement you can. It just makes for an easier, cleaner, less bloody crown seat appointment. Okay, so now everything's been cleaned off and we are trying in the final crown. We're going to just visually inspect the buccal and the lingual. You can feel it with the Explorer to make sure the margins seem like they're well sealed. Go ahead and check the contacts with floss. And then in our office, we take a verification film, or at least take a film to see how well it's seated. You can see here what we have the patient doing is biting on the bite wing holder with an actual 2x2 gauze over the crown just to exert some downward pressure on it so that it's not wobbling around or sitting kind of cockeyed on the tooth. And here's the end result of that x-ray. You can see that there is it's sitting on there fairly well. If you look at the mesial and the distal, it would appear that there is an open margin on this crown, but that's just how they look when you took a film without the cement in it. You'll see later on, once we get the cement loaded in there and it's put in place, it looks perfect. But this is what would look like a crown, at least an EMAX crown, when tried on the tooth. And again, we're just making sure that the margins are well sealed. Okay, so now we're also going to check the occlusion, and in his case, it looks like he was hitting fairly well. He said that everything felt fine, even though he was numb, he could still sense that the occlusion felt good, and our paper shows that it was marking well. There were a couple of minor adjustments we did make to the interproximal contact, and when we are finished making those adjustments, we're going to go ahead and polish that, whether it be the occlusal or the interproximals. We will go in with our polishing discs. In this example, we're using a product by Axis Dental, and we'll begin with the green disc, which is the most coarse one. That will actually remove some porcelain, so you want to be careful with that disc. But then we're going to move on to the blue one, and then the yellow one will leave it with a nice fine polish. Okay, now we're getting ready to seat the crown. We're going to go through these steps, and then we'll show you step by step how we do that. We're going to lubricate the outside of the crown. What that's going to allow us to do is make for an easier, cleaner cleanup so that the cement doesn't stick to the outside of the crown. Measure out the cement. We're going to isolate the tooth, make sure there's no saliva that can get to that tooth while we're going through this process. Once the tooth has been washed and dried, we're going to coat that tooth with microprime. The cement will be mixed. We'll load the cement into the crown. The assistant will then transfer that crown to the doctor, so the doctor simply has to pick up the crown and go directly onto the tooth. Doctor seats the crown, and then the patient will bite lightly on a cotton roll. Okay, so here is our lubricant. You can see it's this high-end, expensive material called chapstick. And when we're putting that chapstick on the tooth, it's important to put the crown on the removable die and then coat the crown. You do not want any of this chapstick getting on the internal surface. And by placing the crown on the die, you prevent that from happening. In that bottom left picture, you can see now the crown's been removed off the die, and you can see that none of the chapstick or the lubricant has actually worked its way into the internal part of the tooth, so we'll be assured of a good cement seal. Okay, now we go to the mouth, and we're going to isolate. You can see we have a cotton roll in there, we've got suction, we're going to wash and dry that tooth, and then we're going to apply microprime. Microprime is just a glutaraldehyde-based desensitizer made by Danville Engineering, and we've just found that this product works very well. It does well as far as desensitizing the tooth, but it also just cleans off the surface, and that glutaraldehyde base creates just a much more aseptic environment upon which you're going to be placing this crown. That is applied, scrubbed on there for 10 seconds or so, and then air thinned and dried. We'll make sure, of course, that the tooth has a dry surface to it before we glue the crown in. The cement that we're using in our office is a resin-modified glass ionomer, a 3MSP product called Rely-X. This has been a great product for us for many years. The bottom photographs show that when you sometimes take the red or pink cap off of the mixing barrels may not be all that clean on the tips. It's important that the assistant clean those tips off, as shown on the right picture, because whenever we're working with anything like seating a crown, we'll make sure that the tooth is clean, that the cement coming out of the dispenser is clean, the pad that is being mixed upon is clean, that the assistant's hands or gloves are clean, that everything is clean so that when you're putting it in, we're not trapping any debris, bacteria, saliva, or anything that may contaminate or jeopardize the final seating of this crown. Okay, so there's the cement being squirted out. It's a paste-paste mixture. The cement is then mixed, it's then loaded, handed to the doctor, and then it's seated on the tooth. And you can see the excess oozes out around the perimeter. You'd like to see it ooze out everywhere. 360 degrees would be ideal. If it's only coming out on one side but not the other, that would be kind of a warning to you that maybe the crown isn't seated down completely. So want to make sure that the cement is oozing out pretty much everywhere around that tooth. Okay, now it's time to do the cement cleanup, and these are the steps that we go through. First of all, we're going to wait for about 1 minute for this material to set. The set time on this material is 2 minutes, but at the 1 minute mark, we're going to go ahead and start cleaning off the buccal and lingual. The assistant should be maintaining finger pressure on the occlusal of the crown while cleaning up the buccal and the lingual, just to make sure nothing gets moved around with the crown while it's still setting. Once the buccal and lingual have been cleaned, then we're going to start pushing some cement through the interproximal using the Explorer. At the 2 minute mark, then it's safe to go in with our floss and remove the other excess cement that might be caught interproximally. Okay, so here we are at 1 minute. The cement now is being removed from the buccal and the lingual. And when we do this removal, the best motion is to push from the crown porcelain down gingivally and then do a sweeping mesial distal motion right there at the margin. It's the easiest way to break the cement away from the gums and the crown and the tooth. If you can see, we went and did the buccal first in that picture on the right. We're now working on the lingual. If you also notice on the right, we don't care about removing that big chunk of cement off the distal. That will be easily removed later. When this material is setting, remember it has a 2 minute set time, you have between that 1 to 2 minutes to get out the vast majority of that cement. After 2 minutes, it becomes increasingly more difficult to remove that cement. So big chunks of cement can be cleaned out later. It's most important during that 1 to 2 minute period to get the cement out from around the margins. Okay, now here we are starting to go in interproximally. We're pushing from the buccal, pushing from the lingual at the interproximal contact. Of course, in this patient, there is no distal tooth, so that makes that part of the cleanup easier. But whenever there's an adjacent tooth, going in and pushing with the Explorer, pushing again, going in, pushing gingivally to separate the excess cement from the outside of the crown, and then push as you need to get any material that's caught between the teeth out from between the teeth. And then after we think we have it all cleaned up, we're going to take a verification film. And here you can see the final crown. It's well seated. Actually, you can hardly even see a cement line on this crown. And that's how these Emax crowns appear when using this kind of cement. It has a very nice finish to it. And here's a couple pictures of the after product. As you can tell, the gums are still bleeding from kind of an aggressive cleanup, but we'd rather go ahead and be aggressive rather than leave behind any cement. Again, this is why the patient is numb prior to the appointment or during the appointment, whether they have had a root canal or not. Okay, here's a couple other cases. Went ahead and placed a crown on this tooth number 3, but you can see on the distal there is definitely some cement left over. That is cement. That is not gum tissue. That is not part of the crown. That is not anything else. That is pure and simple cement. Here, number 12, you can see we tried in this crown on the top photo. That's just without any cement at all. You can see that that's how it looks. But once we put the crown in and got it cleaned up and went back and took our verification film, the distal of that tooth looked really good, but in the mesial, if you look real close, there is some cement left over, and that would have to be removed. And how we can remove that cement is we can go in, again with the Explorer, with some floss. Sometimes we may have to use an interproximal saw. This is kind of like a little hacksaw that you can go in and knock out some stubborn areas of cement. You can use an ultrasonic. I like using the P-tip on the Piezon unit. That seems to get in interproximally really well and clean out the cement. Or of course you can use any mixture of periodontal scalers to remove that cement. Anyhow, that is how we do our cement appointments here in our office. And we look forward to showing you some of our other cases in future presentations. All right, thanks.